More than 3 million people have warts, and most of them are actually children. Dr. Michael Kim joins us now live in the studio to talk about ways to get rid of those warts. One of those things we don't like to talk about, but most of us had to deal with it at one point or another.
Yeah, now we're basically talking about hand warts because there's obviously genital warts and other types of warts with a different variation of the virus. But yeah, we see so many patients with these warts, and a lot of people may not realize that it's related to an HPV virus, human papillomavirus. So a HPV virus actually gets into your cells, and there's probably over 130 variations of HPV viruses. Luckily, the ones that cause the ones in the hands generally do not predispose to cancer. So, but they do cause these annoying warts, and they're very, very difficult to treat. And these are these perinucleal ones around the nail. You can see how engrossed they get around the nail. Very, very hard to treat. And unfortunately, being a hand surgeon, often I'm the last resort. They've seen the dermatologist, seen the family doctor, they've seen everybody, and then they come to me. So I'm the last person to see these, the ones that are really hard to treat. And unfortunately, the reason we don't like treating these is because, as a surgeon, we like to do things we know will work.
Right.
And any treatment for warts, probably at the highest, has about a 60 to 70% cure rate.
That's it. Wow.
So a lot of these will recur. Even duct tape, I always tell kids that come in that the first thing you could try is over-the-counter salicylic acid and also duct tape. Because when you duct tape, for some reason, the pressure made them go away.
So you wrap the duct tape tightly over the affected area?
Yeah, but probably 6 out of 7 days, give the finger a rest for a couple hours and rewrap it. And then if that doesn't work, they end up to the dermatologist and then to me. The other treatment possibilities, we usually the freezing, burning. You can see they're not cured. The home remedies you can try. Burning, shaving, lasers, topicals, they all have about the same cure rate. And I do all these treatments. I usually start out with shaving them off and burning the base, go pretty deep, so it's a deep burn. If they keep coming back, there are some topicals that the dermatologists use, like cantharidin. And then there's different variations of lasers. We have the vascular laser, we have the IPL laser, we have the CO2 laser, the erbium laser. So various lasers can also be treated to burn these off.
In one of the bits of information that you gave me, you're saying that you can get this or spread it via towels or even just touching?
Apparently so. Even I think the statistics show that, like, for example, nail biters. So you kids out there bite your nails, probably should be biting your nails. Any opening of the skin does predispose you to get warts from other kids. So, nail biting or any cuts, it is transmitted from person to person. So if you touch a wart and you have an open sore, certainly you can get one. And a lot of people don't realize that. So if you have any friends that have warts, just take precautions, wash your hands, don't share towels, and you should be okay.
All right, Dr. Kim, thank you so much. As always, we appreciate it. And you are watching Week News This Morning on WXCW. We'll be right back with a look at your top stories and your weather and traffic.